We call it accidental awareness under general anesthesia. And if it's ever happened to you, I want to say this clearly before anything else. You weren't imagining it, and you weren't being dramatic. It's real, it's documented, and you deserve to be believed. I'm Dr. Karen Francois, a board-certified anesthesiologist, and I want to talk about the thing patients are most afraid to ask me about. So let's start with how often it actually happens, because the honest answer is reassuring. The largest study ever done on this, called NAP5, looked at the whole of the United Kingdom and Ireland and found that patients reported awareness in roughly 1 in 20,000 general anesthetics. Other studies that questioned every single patient directly found it higher, closer to 1 or 2 in 1,000. So depending on how you measure it, it's somewhere in that range. Either way, it is uncommon. And here's something most people don't expect. About 2/3 of these experiences don't happen in the middle of the operation at all. They happen in the in-between moments, while you're drifting under or while you're surfacing back up. And about 3/4 of them last under 5 minutes. Now, I'm going to be honest with you about the part that's harder, because you deserve the whole picture. The thing that makes awareness frightening usually isn't pain. It's paralysis. In many surgeries, we give a medication that relaxes your muscles completely, so the surgeon can work safely. On its own, that medication doesn't make you unconscious. So in the rare case where the anesthetic depth isn't quite enough, a person can be aware while being unable to move a single muscle to tell us. The studies are very clear that this sensation of being frozen, more than anything else, is what causes lasting distress. And there's a cruel twist in the mechanics of it. That same muscle relaxant takes away the clearest signal I normally rely on to know you're too light: movement. When you can't move, you can't show me. And that's exactly why I have to watch everything else so carefully. But here's the finding from that big study that I think about the most, because it's genuinely hopeful. Patients who understood what was happening did better. The people who heard a calm voice explain it, who knew that this was a known thing and not the end, carried far less trauma afterward. Understanding was protective. That's actually why a video like this matters. Just by knowing the name of this and knowing it can be handled, you're a little more protected than you were a minute ago. So let me tell you what's happening while you're asleep, the part you never see. I'm not sitting in a corner. I'm watching your heart rate and your blood pressure respond moment to moment. I'm measuring the concentration of anesthetic in every breath you exhale to confirm you're deep enough the entire time. In certain cases, I'm using a monitor that tracks your brain's electrical activity. And the most important safeguard of all is the simplest one: a trained anesthesiologist physically in that room the whole time, doing nothing but keeping you safely under and bringing you back. And if you're nervous before a surgery, I want to give you something to do with that feeling. You're allowed to ask questions. Ask your anesthesiologist how they'll monitor your depth of anesthesia. Ask them if they'll be in the room the entire time. A good one will never be annoyed by those questions. We'll be glad you asked, because it tells us you understand how seriously we take this. 2 things are true at once, and you're allowed to hold both. Awareness is real, and the people who've lived it deserve to be believed and cared for. And it's rare. And it stays rare precisely because someone is sitting beside you the entire time whose only job is to keep you safely asleep and bring you home. Fear does better with information. So now you have it. See you in the next case.